Hey future doctors, welcome back to our channel Teddy Guides You. So today we are going to discuss about age related cataract. So this is the most frequent question or common question that we ask our patients while taking history. So that question is, do you have cataract? In Telugu they are called as suklalu. మీకు శుక్లాలు ఉన్నాయా అండి అని మన హిస్టరీ తీసుకున్న ప్రతి పేషెంట్ దగ్గర ఇన్ఫర్మేషన్ని తీసుకుంటాం లైక్ కోమార్బిటీస్ లాగా. సో హియర్ ద ఏజ్ రిలేటెడ్ cataract which is also called as senile cataract. Senile means age. So it is most common acquired cataract. So what are the basic points that you must remember? So they affect both males and females equally, and they are seen in the patients or people who crossed 50 years of age. So it is an age related disease. So they can be present bilaterally, but one eye affected earlier than other. So these are the basic and the most important points that you must remember. Okay, so whenever you are going to take the history, no matter the gender, while asking comorbidities about hypertension, thyroid, diabetes, you should also ask the history of cataract. Okay, so what are the types of this senile cataract? The mnemonic for this is, can you mixed cataract exist? Can you mixed cataract exist? C for cortical cataract, which is soft, N for nuclear cataract, and M for mixed cataract. Okay, for example, if this is lens, so this is the nucleus part, this is the cortex. So cortical cataract, nuclear cataract, and both mixed cataract. I hope you are clear up to now. Okay. C, cortical. C for cuneiform, like wedge shaped cataract, and cupilliform, like there is involvement of posterior subscapular cataract. In nuclear cataract, you will see it is hard and there will be progressive yellowing or browning in nuclear cataract. And the last one is mixed cataract. It is mixed with both cortical and nucleus. So all the symptoms are also mixed here. Okay, so remember the percentage of this cataract is also important. For cuneiform it is 70%, nuclear it is 25%, and posterior subscapular cataract it is 5%. So what are the major causes for this cataract? So the etiology is age, which is the most important risk factor. Second one, hereditary. So family history will increases the risk of having this senile cataract. And UV light exposure, which is more seen in tropical seasons, and nutritional deficiency like lack of proteins, vitamins, and A, C, E vitamins. And during dehydration in childhood, smoking, diabetes mellitus, myotonic dystrophy, in which you will see Christmas tree cataract, atopic dermatitis, there will be 10% risk of atopic cataract, and the mnemonic is aging, genes, sun, diet, smoke, diabetes, and allergy. So these are the etiological features or the causes that you must remember regarding acquired or senile cataract. So these are acquired cataract. Now the question is whether they are sudden in onset or gradually progressing. The mnemonic is love is in my heart. Love, L for lamellar separation. So there will be appearance of water cleft and vacuoles appear. First step is there will be lamellar separation of the lamella. Next one, incipient cataract, which is early detectable opacities. There will be opacities of dots or patches here. Next, you will observe immature cataract, like there will be partial opacity and iris shadow is visible. Okay, now I will explain you with an image. For example, this is eye. This is the normal eye. You will find small opacity in the pupil region. So this is incipient cataract. The opacity will increases in size leads to immature cataract, and it increases further most which leads to mature cataract, and the opacity increases to its maximum, which is called as hypermature cataract. So these are the important steps. Very easy to remember. Lamellar separation, incipient cataract, immature, mature and hypermature. As simple as that. This hypermature is further divided into types. First one is Morgagnian cataract. Second one is sclerotic cataract. Okay. So in Morgagnian cataract, you will see liquefied cortex and nucleus sinks. Nucleus sinks because the cortex is liquefied. Second one is sclerotic cataract. Here you will find shrunken lens and thickened capsules. The capsules are thickened, the lens is shrunken. So these are the important points that you must remember. So what are the symptoms of this senile cataract? So the symptoms are glare sensitivity, like there will be difficulty in while driving in night time, or difficulty in bright lights, or blurred or misty vision, diplopia, you will see double vision. Color halos are seen due to light dispersion due to lens changes, poor color discrimination, black dots in vision and second sight. So here the clinical signs and examinations are oblique illumination, useful for lens opacities, iris shadow test, slit lamp examination and distant direct ophthalmoscopy. And here there will be visual acuity impact seen in nuclear cataract, which leads to myopia. Cortical cataract leads to hypermetropia, and mature cataract you will see no red reflex or white pupil. And the last one is special features of different cataracts. So here in cortical cataract you will see spoke like opacities like star and late visual loss. In posterior subscapular cataract you will see cupilliform opacities in central posterior cortex and early visual loss. And in nuclear cataract there will be central sclerosis which leads to progressive myopia, which is nothing but second sight. Okay, let me explain you clearly. Here in cortical cataract, for example, you will see spike like opacities, which is star shape. Posterior subscapular cataract, here there are two forms. First one is wedge shaped, second one is central bow shaped opacity. So if this is lens, you will see opacities here. So this is called as cuneiform cataract. Second one is cupilliform cataract. The opacities are present in the central posterior cortex. And the next one is nuclear cataract. You will see central sclerosis. So these are the important points that you must remember regarding age-related cataract. Hope this video helpful. Consider subscribing to the channel Teddy Gets You for more interesting videos about MBBS topics. This is Harshita signing off. Thank you so much.